Well, in the meantime, your vaccine expert panel daw, Doc, is looking at the efficacy data no, on using other brands as boosters for Sinovac. Pinag-uusapan na talaga yung boosters ngayon kahit even if we don't have enough vaccines, Doc. And can you tell us more about this, yung crossing brands for a third shot of Sinovac in particular?
Okay, I would like first to make mention about why we mentioned about booster, and it is because of the data coming from some of these vaccines that immunity waned, so meaning the protection waned after 6 to 8 months. And the most vulnerable among these, of course, are the healthcare workers. Okay.
Yes.
And we have experienced also healthcare workers getting sick, Although majority are mild, there are also who are moderate and severe. But again, the point there is that if a healthcare worker will be sick, and then your people, your personnel in the healthcare facility will also dwindle, then that will also affect the function of that healthcare facility. Okay, so that's the reason why that when we make that rationale and point of a booster, we have to select which vaccines has the data that immunity has waned, and so that's the recommendation. But I think it has been with the Department of Health now that it's up to them to decide on that based on some of the areas that we need to consider, like the limited supply of the vaccine in the country. Second is that is a third dose still enough to protect us against the Delta variant, or do we need another platform for those who have been vaccinated? So these are the things that we need to weigh in at this point in time.
What do you mean by another platform, Doc? I just want to clarify. So you're saying it's what is that? Because you just said booster ba or another platform? What would be another platform?
I'll give you an example. So halimbawa, you have received 2 full dose of your Sinovac in March,
Yes.
So the third dose will this be a third dose of a same platform like Sinovac, or will the third dose be an mRNA vaccine or a virus vector vaccine like Astra? So something like that, So which we have to evaluate which among these 3 platforms will give you a better protection, because when you boost, so binigyan mo na ng pangatlong then you have to maximize na lang ano ang pinakamagandang protection against the Delta variant.
Right.
Pero Doctor, did I get it right na may recommendation na kayo to the DOH? Anything specific for health workers ba?
Yeah, but the current data tells us that a third dose of Sinovac gives you a higher protection, better protection compared to the 2 dose after the waning on the 6th month. So that's the recommendation.
So after six months pa, tapos the same. I see. So hindi ka pwedeng mag-ibang platform, to use your word, or pwede rin?
There are already data now coming out, that another platform can be as effective or higher than that compared to a third dose of Sinovac. And there are countries now using another platform to those fully vaccinated with Sinovac. I'll give an example now, because I've talked also with my colleagues there in Thailand. They're giving AstraZeneca as the third dose, or those who received the first dose of Sinovac, they gave AstraZeneca. Okay, so that's their vaccination strategy option for the healthcare worker. In Indonesia, they're giving an mRNA vaccine. After the 2 doses of the Sinovac, they're giving a third dose of an mRNA vaccine. Okay, so these are all healthcare workers. These are not general public. So these are just specifically for healthcare workers.
Yung healthcare workers nyo, Doc, specifically for COVID referral centers, yung recommendation nyo, or for COVID wards? Or
for COVID referral centers only. So selected COVID. So these are the healthcare workers who are taking care of COVID patients on a daily basis.
So how many are we talking about?
I don't have the figures now, but mukhang konti lang to kasi we're talking about mga referral centers in Metro Manila, primarily government referral hospitals, no? And that was the recommendation.
So, kung
Doc,
ganyan
I-
ka konti, it's possible na papayag ang DOH. You think?
I cannot answer that, Ami, no? So it's up to DOH to decide on that, but because it's still DOH who will really give the final decision on matters related with booster and those who will get the booster.
Doc, I do remember
Okay,
as
but
early as
if you're
last
not
year.
a health worker, sorry, but if you're not a health worker and do you think there is a need now, especially for those who had taken their first and second doses early on, like let's just say May, should they be preparing themselves for booster shots, say November, ganyan?
Because of the limited number of or supply of the vaccine, the target is still vaccinating those who are not yet or has not yet received any single dose of the vaccine.